Good morning.
How are you today?
How are you guys?
Doing well, doing well.
It is hot and windy, right? It is. I think summer jumped ahead a few days before it became official.
Mhm. I'm not a fan at all.
No.
Hey, Heather. Okay, our live stream is up and running. Sometimes it takes a little bit and I get nervous, so I always try to start it a few minutes early just in case it needs some time to connect. Okay. Hi, Brenda. Nice to see you.
Sorry, I'm doing this with my phone and figuring out all the buttons.
And it's so weird and different when you're used to being on a computer. So definitely no worries.
Good morning, everyone, and welcome to the June meeting of the Kansas Early Childhood Recommendations Panel. My name is Cornelia Stevens. I'm the Executive Director of Top Early Learning Centers in Wichita, and I have the privilege of serving as chair for the panel for this past year. Uh, our panel members, we'd like to thank you for serving Kansas children and families and our state's early childhood care and education professionals. This is a remote meeting, so today's meeting materials are posted on the panel meetings webpage, which is on the Children's Cabinet's website at kschildrenscabinet.org. Panel members, I ask you to please clearly identify yourself when you begin to speak. You can either use the raise hand feature or to show that you're ready to share, just to make sure that Lindsay and I don't forget you if you have comment or questions or anything for anybody that's presenting. For today's meeting, we will be approving the June agenda, approving the May minutes that were both already sent out. We don't have anybody today for the Kansas Open Forum, but I will go on ahead and give an overview in case we have any Kansans that are interested in presenting any information to the panel. We'll have an update on the All In for Kansas strategic plan. We'll have presentations from our work groups. And so our work groups have been really busy this year doing some pretty amazing things. And so it'll be great to have everyone share the information of the progress that they've made thus far. We will have bright spots. So panel members, start thinking about amazing things that are happening within your organization, within your community, or at the state level that you're aware of that you'd like to share. We'll talk about upcoming meetings, and then our meeting will adjourn and work groups will have the opportunity to meet, follow the meeting if in fact you're planning on meeting today. So the first thing that we're going to do is approve the June minutes. Panel members, again, clearly identify yourself when you begin to speak and make and second a motion. So the June agenda was sent out by Lindsay. Hopefully we have all had a chance to review the agenda. So may I please have a motion to approve the June agenda as presented?
This is Kathy Gray. I make a motion to approve the June agenda.
Perfect. May I have a second?
This is Karen McCrory. I second the motion.
Thank you. All those in favor, thumbs up. Any opposed, same sign. Great. The May minutes were also sent out. We had an opportunity to review those, and if there are no revisions, may I have a motion to approve the May minutes as presented?
This is Heather Schoberger. I move to approve the May minutes as presented.
Thank you. May I have a second?
This is Kim Kennedy. I second that.
All those in favor, thumbs up. And any opposed, same sign. Okay, so as previously mentioned, we do not have anybody present speaking today or that submitted information for the Kansas Open Forum. But if you happen to be watching the live stream, I wanted to let you know that we do have opportunities for Kansans to submit comments or thoughts, ideas, anything like that to the recommendations panel. Those are submitted through a Kansas Open Forum comment form, which is also present and available on the Kansas Children's Cabinet's website. That needs to be submitted by 5 p.m. the day preceding each meeting. And you have the option of either submitting written comments or signing up to verbally share comments with the panel during this portion of the meeting. So if you have any information that you'd like to share, we would love to be able to hear from you. And I would love for you to share information, submit information. We'd love to be able to hear from our panel, from our Kansans. First on the agenda, we have, in terms of our presentations, we have Megan Kluth, who is going to give an update on the All In for Kansas strategic plan.
Good morning, everyone. Thanks for having me again. I'm going to share a little bit, and I'm actually going to hand most of the time over to a colleague, Chavis Lickbar-Armstrong, to talk more about the strategic plan. But wanted to share a few PDG updates. So one is, for several months now, the Child Care Systems Improvement Team and Child Care Licensing Team at KDHE have been hosting regional roundtables. They're getting ready to host their last one for the year later, or next week, actually, in Hayes. So if you know anybody in the Northwest region that might be interested, I think Lindsay has the flyer and can send it out. These have been well attended, and I think we've heard a lot both about what's working really well with childcare and where there's some opportunities to help support communities in a different way. So thank you to everyone who's put the work in on these and been able to help promote them and get attendees. Next slide. All right, the childcare zones, I think I've shared a little bit about this and just wanted to kind of give you a status update. So these are grants that have been awarded by KDHE through Child Care Licensing, and their focus is really on bringing a minimum of 2 counties together to create a sustainable, very locally driven childcare solution. So it's really about building like community capacity to addressing childcare, and the communities are able to say, these are the most pressing needs for us. Here's how we want to go about it. So, for example, some of the things that have been really popular have been employer engagement, like kind of more that business and private sector engagement, increasing workforce capacity through professional development, financial incentives, substitute pools, expanding to non-traditional hours, and different types of partnerships. So it's all really about creating like childcare ecosystems at the local level. So we did the first round of funding this spring, and the groups that you can see on screen are the first 4 childcare zones grantees. So you can see it's pretty spread out throughout the state. And then we are just getting ready to open a second round of applications. So those will be due in late August. So if you know anyone who might be at all interested in this, there's technical assistance available. The team is happy to get on screen and just talk through, like, does this seem like the right fit? Even if somebody has kind of like part of an idea and isn't sure what to do with it, I think it's worth a conversation. So it's gonna be really exciting. These are hopefully 3-year grants that we'll really be able to hopefully see what we've been talking about as like childcare culture change in the region at the end of this. So we'll keep you posted. The grantees literally just got started, some of them this week for the first time. So we'll be following them closely and excited to share more progress. Next slide. Okay, my last update is one of our partners, Mindful Minis, is a mental health informed childcare center outside Wichita. They have their sister organization is Mindful Collective, which is doing some work to really expand like their mental health best practices for childcare around the state. And so one of the things they're getting ready to launch is a free online training for early childhood professionals. They tend to be a little more focused on childcare just because that's where they are, but certainly I think the training could be applicable to all sorts of early childhood professionals. And it's really about what they call their CARE approach, which is connect, accept, regulate, and empower. And so it's all about how are you having positive interactions with between kids and teachers, and really just in general. How are you helping kids with kind of regulating emotions and understanding like that children have mental health, and how to like be proactive and positive and working with kids, and then also like kind of how those lessons can be consistently applied at home as well. So it's an online training. They're working on getting their KDHE approval right now, so that should be ready by the time it starts. And it starts July 8th. So Lindsay has a flyer for it that she'll send out with the meeting notes, but I think if I'm hoping it'll fill up quickly because I think this has been a really popular topic. But if you know anybody who might be interested in this training, please spread the word. It's available statewide. And with that, I'm going to hand it over to my colleague at KUCPPR, Chavis Lickbar Armstrong, who is doing a lot of work on the early childhood strategic plan and developing a monitoring framework for all and for Kansas kids. So, Chavis.
Thank you. Thanks for having me this morning. Like Megan said, my name is Chavis Lickbar Armstrong. I'm an associate researcher with the Center for Public Partnerships and Research, and I'm excited to be sharing this new initiative with you that we're developing and see strong collaborative opportunities on this project with you all as a group. Lindsay, you can go to the next slide. Or perhaps I draw it, not sure. All right. So as you all know from being part of this group and also in the work that you do every day, that Kansas has a really strong vision for early childhood that's founded in the Blueprint for Early Childhood and also demonstrated in all of the work that's done through the All In for Kansas Kids initiative. And because of our PDG funding that we've had for several years now, we also have had the opportunity to do robust needs assessments. And from those, we've developed a strategic plan. So our plan, which is called the All In for Kansas Kids Strategic Plan, reflects the state's commitment to enhancing the early childhood ecosystem. And it focuses on the ecosystem, workforce, and environments and experiences of children and families. We'll go to the next slide now. And just a reminder to you all, I'm sure you have the strategic plan document with you, but this is how it's sort of organized. It's grounded in 3 topic areas that we call pillars, and I already mentioned those. And within each pillar, there are goals. There are actions related to each goal, and then there are also some progress tracking opportunities that are spelled out in the strategic plan itself. You can go to the next slide, please. So we have a strong vision. We have a plan. What's missing from what I see as a 3-legged stool is a way to be accountable to the system and to the work. So, and it's not, and I'm not saying that we're not being accountable. What we haven't developed yet is a really strong way to track and report on that accountability and all of the actions that are taking place that really support our plan for achieving that vision. So what you see here is a monitoring framework that we're developing. And what it is designed to do is enhance the strategic plan framework that already exists by adding some elements that will allow us to capitalize on the data that everyone in Kansas is doing activities, or a lot of people in Kansas are doing activities that support the strategic plan. And what we want to do is connect with those folks and see how the activities and the work that they're doing and the data that they're collecting can be connected to the actions in the strategic plan. So what you see here in dark blue are the elements of the strategic plan that are written in the document. And in the light blue, these are the framework components that we're building in kind of in the background. So we're working to develop some measurable objectives for each of the goals. And we're also reaching out to organizations and the state agencies that are supporting activities related to the strategic plan across the state to kind of work with them to utilize the data that they're collecting in order to speak to those progress tracking metrics. So our short-term goal really is to maximize data that's already being collected and use that to say how we're progressing towards the vision through the strategic plan. And then our long-term goal is to build synergy between program data goals, those goals that program implementers have for the outcomes of their programs. And we want to connect those to the goals that are outlined in the strategic. I am monitoring the chat, so if you have any questions, please feel free to use that. And we can go to the next slide. So our next steps, you saw an overview or a sneak peek of what the framework looks like. Our next steps is that we're still seeking data that supports the actions outlined in the strategic plan. We're also building a My Sidewalk dashboard where we're going to be able to report and show the progress that's being made. And I'm really excited about that because it's a robust platform that allows us to show data visualization, but also tell stories. So as this work progresses, everyone in the state of Kansas will be able to see how we're making progress towards our vision through the strategic plan in both stories that are told from program implementers and also through data that is collected by everyone who's doing that work across the state. Go to the next slide. So like I said, when I started giving you this update, I think there's going to be a lot of opportunity to work with you all as a group to build this momentum on this initiative. But also in the meantime, I would love for you to think about the organizations that you're here representing and think about whether you have data that you know aligns with the actions in the strategic plan and you'd like to connect, talk about how we can use that data to show progress towards the goals in the strategic plan. Also think about whether you don't know, whether you assume your activities are supporting the strategic plan, but would like to meet and talk about whether or not they do or where they do and how data can be collected or how your story can be told. So please feel free to reach out to me. This work is ongoing. Like I said, I'll be back to give updates on it in the next several meetings. But please feel free to reach out to me. My email is on this slide, and I'd be happy to talk with you all and give you more information or work with you to align your organization's work with the strategic plan.
Are there any questions for Chavis or myself around PDG and the strategic plan?
Well, thank you all so much. Please feel free to reach out.
Well, absolutely. We always appreciate hearing updates. And so collecting that data and making sure that what we're doing is making an impact is going to be, that's going to be huge. Next, we will hear from our work groups. And so thank you all for preparing presentations for everyone so that we can hear about the great work that you have been doing. First, we will hear from a spokesperson who will give an update on the Family Friendly Workplaces work group.
Samuel with DCF, and just wanting to share with you about our family-friendly workplaces that we've been working on. Do we have the slides for this, Lindsay? There we go. So what we've been focusing on this year is a family-friendly workplace name to be decided, some kind of designation. And this designation would be designed to recognize the importance of robust, comprehensive work that employers would do that would help strengthen our economy and further the well-being of our Kansas children. So we had started out this year talking about why we feel like this is important, that employers, in order to really invest in their employees' families and benefits for the families, that they would really appreciate some kind of recognition, a designation, some way for them to, be able to advertise that they've done this work, that they are offering benefits to help them attract employees. So we did a lot of research, checked out a lot of what was going on in other states to see how they had implemented this work. We found many other states, and we even looked at Australia as well, that had robust designations that they offered, and looked at the different components of what that was and tried to kind of compare all the different things that were there. And then after we did that, we actually were able to contact and have peer-to-peer calls with several states, North Carolina, Oklahoma. I think we met with somebody else, Wisconsin or New Mexico, and talked with them, and really was able just, to have these conversations where we discussed like what worked for them, what did they try that did not work, how did they come up with the criteria or the system or whatever it was that they ended up with, and really was able to learn a lot of very insightful facts from that. And then we took all of that information, and we compiled it and discussed it a lot, and just decided we wanted to take the strongest pieces that we thought would work for us specifically in Kansas and the communities that we have here, and then to create a framework by putting that all together. So what we ended up coming to the conclusion of is that in these conversations, it was discussed that employers really respond well to having a neutral organization, a nonprofit, a foundation, something that would be the one to run the designation, that it needs to, in order to have that recognition from employers, that it would be best to have this kind of neutral organization that to support the designation, to hand out the different awards that would be part of that. And then as a part of that organization, there would be some sort of advisory board that would be in charge of developing this. And then also, finalizing criteria and different parts of that. So that was one thing that really stood out to us from our conversations, as employers were more receptive to some kind of neutral, a non-state entity. Important components that we settled on were, there needs to be some kind of structured application. A lot of, and this was a bit surprising, but a lot of designations in states charge some kind of fee, which actually was very successful. They did not have a lot of pushback from employers for that. Part of that being that if employers invested in the process, then they were more likely to take it seriously and to really, want to get more bang for their buck, so to speak. So we felt also it was important that this designation would have tiered recognition, so there'd be different levels. Obviously, not all employers are able to do all different criteria depending on how many employees they have, or what type of business they are, but they would have that ability to choose, fall in a certain tier, and then if they wanted to progress through tiers. One other thing, and we have this in Kansas, is it's important to have an instrument to capture employee experiences. Some states we looked at only talked to the employers themselves and asked what they were doing, but we really liked that continuing to get the employee voice involved in the process. Other components, making sure that these employers, it's not just about the designation itself, but that we include technical assistance, education, help them understand the different options that are out there, what the different benefits are that they could participate in, childcare tax credits or different things like that, that they would be able to just get more information and figure out how maybe that they would implement something for their own business. There would be some sort of renewal cycle. So once an employer received a designation, they wouldn't just, check that box and have it forever, but there'd be some sort of renewal process. And then again, having that advisory board be a part of this development. Some more criteria. We would want to have the employer, make a commitment to the process. There'd be some sort of designated point of contact that we would have with them for all of this to help them through the designation, and making sure that surveys were being, submitted, and all of those different criteria. If they had questions, they could ask. We split this up into different policy domains. That was another part that we had discussed with other states, and we kind of combined their domains into ones that we felt worked best for Kansas. Paid leave, health support, work schedules, economic support is what we had split those policy domains into. And then as they go through all this, they'd complete the different kinds of surveys in those domains. There would be some kind of initial certification. You can see that criteria there. And then depending on how they fell within that, then they would be awarded, a certain level. And then the survey data would inform all of the scoring and certification, and then shape the employer's plans for moving forward. So we have a lot of this fleshed out in some ways, but there's still much work that needs to be done to finalize this designation. So we ideally would, before we get into the nitty gritty and the final details, what we would like to see is we would like to seek a home for where this designation would belong and explore what that might look like. And then from there, move into formalizing the advisory board. And ideally, the advisory board would be comprised of different entities in the state that would be experts in working with employers, human resources, early childhood experts, and entities that an employer would recognize, and also that they would respect and want to work with. So that's the kind of composition of the board that we're looking at. And so we would need to, formalize that charter The survey instruments, they would need, to be developed, and scoring rubrics and all of that would need to be finalized. Like I said, we discussed that a fee structure, a fee would be waived most for like employers that have 10 or less employees, but there would be like probably a graduated fee structure for, 10 to 50 employers, 50 employees or 50 to 100, it would go up based on that. But that needs to be finalized as well, how much each level would be. And then, of course, finalizing the specific criteria of what level has what requirements. So this work is still in progress, but we feel like it's important, and we recognize that it would probably take something like this in order to help encourage employers to move forward with offering family-friendly benefits and activities and things to their employees. So I have here a slide that has all of our contact information on it. So if you have ideas or questions, or if you want to reach out because you have you want to discuss with us what you think that this could look like, feel free to reach out to somebody in the group, and we would like to get together with you. So thank you very much.
Thank you, Bethany. Do we have any comments, questions, anything like that for Bethany and or this work group? Okay, and so in terms of like next steps, is there anything, does anybody have recommendations, input, anything like that that they saw that maybe could give guidance, of like any of the things that they're kind of hoping for in terms of next step? If not, that's okay. But we definitely have a lot of great minds, here, and wanted to give opportunities for people who haven't been on the work group to give input. Amy, I see your hand.
Yeah, this is Amy Gottchammer with Google's of Learning Child Development Center. I was just thinking, Bethany, as you were going through the slides, that depending on what the structure of the organization ends up looking like, if it becomes some sort of a nonprofit, or there's a vehicle for taking in donations and then being able to then offer grants, maybe that's a way to enable you to give out funding to certain businesses that can then improve themselves as trying to achieve some of these things. Maybe they want to set up, a breastfeeding or lactation room for their employees, but they'd like to get a rocking chair and they'd like to do some other things and they don't have the funding for it, that then you might be able to give out some grant money. I don't know, some of those things started occurring to me as you were talking. So anyway, just a thought.
Yeah, for sure. I think one of the most challenging components of this is figuring out the money part of it, because it would require having someone, run this thing, and that's probably going to cost money. And for sure, having a fee structure would hopefully pay for at least most of that or all of it. But what that looks like, I think that's still a big question mark for us, that we're trying to figure out. But yeah, ideally, if once we get down the road, some of those things that we could look at would be exciting.
Any other comments, thoughts? If none, thank you again, for providing the update. Next, we will hear from someone who will be speaking on behalf of the Workforce Exit Interviews Work Group.
That would be me. Good morning, everyone. I'm Stephanie Wiggins with the Exit Interviews Work Group. So we kind of started with that purpose. We all know that High quality care, especially in early childhood, depends on those professionals that are both qualified and well supported. And we know that consistent and safe environments for children start with investing in those people. Yet we still have a critical concern in Kansas that we have the shortage of these qualified professionals. And it doesn't just impact children and families, it has that bigger economic impact as well. And so the team this past year has made steps towards developing a data-informed system to better understand and address workplace shortages by looking at the reasons why those professionals and educators are leaving the field. And when we have a statewide exit interview process, it helps us to uncover some of those trends and challenges and help to offer insight to support those stronger workforce retention efforts. On that next slide, yep, more specifically, we can implement a statewide exit interview system to gain that real insight into what's working, but also what's not working. So we can make smarter policy decisions, invest in the right supports, build a more stable and equitable system, ideally. And in short, those exit interviews help to give us a direct line to the lived experiences of the workforce. And I think this just resonates with me is just this thought of when we listen to people's reasons for leaving, we learn how to help them stay. And so we have some of these key reasons for understanding why the workforce is leaving. So we're looking at improving retention, right? We can take steps towards preventing leaving the field if we know and can improve that retention effort, whether that's specifically looking at low pay or burnout or lack of advancement opportunities or poor working conditions. We can target those changes that can help retain that skilled workforce. We're also looking at ensuring quality and continuity of care. We know this, right? High turnover disrupts those relationships, those critical relationships between children and educators, which are foundational for that healthy development for young children. And we also know that families benefit when those children are cared for by those consistent, trusted, loved adults. We know that we can have better informed policies and investments. That exit data can show real world insight that can help shape effective funding, training, workforce policies across the state, and helps us, to connect with those leaders in the state that are making decisions and can make those decisions on evidence rather than just on assumptions or non-based in evidence. Highlighting systemic barriers. We also know that we can find that professionals, maybe from marginalized communities, might face some additional challenges that we haven't quite captured in the data just yet. And so when we have exit feedback that helps us to look at those systemic barriers, it can help to surface those equity issues. Maybe that's lack of support, discrimination, language barriers, whatever that may look like as far as systemic issues go. We also see it can strengthen the workforce pipeline, right? So we know that sometimes people leave for positive reasons. And I think it's important that we look at that as well, because we can look at those trends to help us design, career pathways that's coming out, help to support looking at career pathways, re-entry strategies, maybe to bring them back into the field as much as possible. And then we can support recruitment and messaging. So if we know what drives people away from our field, we can also refine those recruitment strategies and help to value kind of those propositions to help attract them back in or attract the right talent and then keep them as well. So our team this year, as you can see, has been pretty diverse, right? So it's from a wide range of organizations that all have a pretty significant stake in the work that we've been doing, which has been great. They've been incredible partners in this journey for this project and really a big part of helping to move it roll forward. And then along the way, we've also brought in some other voices outside of this recommendations panel, folks from Child Care Aware Kansas, Northwest Kansas Economic Innovation Center, Casito Research and Evaluation Team, and the Workforce Registry team. And I'll jump into those in just a little bit for how they've been really beneficial for this project. But across the board, having all of these perspectives at the table has been essential to build a strong, comprehensive tool that we can really garner some useful results. but we're not done yet. This isn't just finalized, right? As we move into the next few slides, we're going to look at the current recommendation along with a draft of some of our interview questions that we're suggesting being used. And so we shared this information with you today, so we want more feedback, just like the last group. We are welcome more feedback. This is not set in stone. There's probably some thoughts going on throughout this that we haven't captured yet. And so hopefully, please don't hesitate to jump in with questions or suggestions as we go. Your input is really important in this process as well. So broad level overview of what we've done so far this year, we started by grounding ourselves in the why. So as a team, we looked at the purpose behind implementing a statewide system, which helped us to be a lot more intentional when we were looking at potential interview questions to ask. And then when we did that, we looked at what already exists. So looking at protocols currently in place, maybe what other regions are doing, what individual programs are doing, different states, different areas. And then from there, we began developing a strong set of our own interview questions that we designed to help us capture the most meaningful data that we could without being too overwhelming in the process. That's something we've always kept in mind too, is that we don't want questions and questions and questions. We want to be really intentional with what we're asking. And then once we had a solid draft, we brought in Casita's research and evaluation team for their expert level eyes on it. And they gave some really incredible feedback to help push us in a more towards a final direction. And then along the way, as we discovered and looked at these research questions and what this might look like, it became clear to us that the long-term home or the best long-term home for this work would be within the new workforce registry system, CAPE. And so then we took it to CAPE. We met with Haley and Tanner from CAPE to share our progress, get their feedback, explore next steps. And they were both fully supportive of integrating this work into the registry. And then where we're at is that CAPE is now bringing the project forward to KDHE and their governing board to begin planning some of those implementation phases as well. And as the process unfolds, we'll continue to stay supportive in that transition to make sure that we're continuing to work with the CAPE Governing Board to help support this project in its full implementation phase. So if I can share, I will go ahead and show you what this might look like. So here's what we have shared with the CAPE Governing Board, as well as a couple of other eyes for this. But this would be our full document as far as recommendation. And I definitely will not read word for word for you because I know that will be a lot. But it does go over background information, intentionally points out those considerations of equity that we've, kept at the front of our minds during this process. So having some recommendations along the lines of having this interview be in multiple languages, in different formats, whether it's paper copies, phone interviews, maybe even possibly compensating participants for their time and expertise just to address that barrier of low feedback rates or low data rates. And then we also know we continue to look at family voice and influence. We know that while we're looking at workforce data, it's driven by the need of Kansas families and the overarching economic support that we're providing for these families and these children so they can go to work and know that their children are cared for in a quality environment with loving relationships. And so we just make sure to keep that in mind, that we have heard from those families about availability, staff turnover, and the overall quality of those learning environments. And so we keep that in mind with that family voice and influence. Our stakeholder and government's involvement groups, obviously this group where this project has kind of started with, but then we've also had that feedback from state agencies, and then we're hoping to have that kind of warm handoff into CAPE because they will be an essential partner in that implementation process because ultimately they'll be the ones that house this project. So we continue to support them in that effort. We're looking at impacted populations, obviously the early childhood professionals, children and families, our organizations, and then our statewide level agencies and policymakers that can ideally use this data in the future to help make informed decisions. We have support for system integration by streamlining this into the existing workforce registry. It just makes the most sense. Providers or educators are already familiar with the registry, or they will be soon. And so having this as kind of a familiar home ideally will help to support redundant data, administrative burden, and just unfamiliarity. And so we likely will garner more responses if we're using a system that they're already familiar with as well. So hopefully addressing kind of a higher participation rate, which has been a challenge historically in the existing systems. Several of just kind of our topics that we've identified through this work is that we want to make sure that we're addressing again, that ability to garner the most responses possible. And so having or providing some suggestions for some automated triggers. So within that registry, thinking through how we can identify as people are leaving the field, how we can automatically know that and then be able to get this real-time data to be able to capture that data as it's current. We also recognize that there's a richer linked data set. So we already have the demographic and professional information. And so when we can capture some of this exit interview responses, we can start to look at those deeper insights, right? Trends by role or tenure, or location or age or training history or supports that were available, whatever it may be. We see cost efficiency since we have the same platform that we're already using or utilizing throughout the state. Let's see, strengthens accountability and transparency. Looking at putting it into a centralized state-supported system helps to ensure oversight and consistent processes across organizations and regions. So we're hopeful that this can help to gather information across the board for the entire state. We've been in a lot of conversation about what different programs are doing. And so there's some existing data on individual programs, but I think that the data will be very valuable to be able to see kind of that snapshot across the entire state for the whole workforce to help address those challenges on a systemic level. Some of the additional challenges or considerations that we've suggested is talking about looking at the data as point in time data, so what we're capturing in the moment, but also looking at the trends as we go throughout. And so having some of that evergreen data, that longitudinal data that provides some of that insight into ongoing trends. Concern and conversation has centered around some of that data privacy and access. And so how that data is handled, ensuring confidentiality, a lot of that will continue to be up to the CAPE governing board, obviously, but we also want to make sure that we approach it and make sure that we start those conversations and have that ball rolling for sure. And then looking at how information from the exit interviews are shared back to our field. So how we're being able to communicate what's going on, why people are leaving for those stakeholders within our field. We also want to capture those positive exits, right? So like I talked about a couple slides ago, not all exits are necessarily negative. Some might leave for promotions or maybe transitions within the field or different life events. Maybe it's a lateral transfer that we can, not a lateral, but maybe it's a step up transfer that we can capture maybe some of those reasons to be able to lean into some of the systems that we identify as working for some of those retention strategies too. And then again, historically, we've had a challenge with getting response rates for surveys, data collection, things like that. And so we've seen a couple of really great things working. Your voice matters. I know, several of these statewide systems that or statewide interviews, surveys that we've had recently has had a couple of great ways to get those responses gathered. And so we hope and suggest that that this project would follow suit with that as well. Just being able to diversify, make sure that we get as many voices as possible in different ways. Timely delivery, clear communication, and funded state agencies. Again, talking all about the ways that we've discussed some of these considerations that still need to be honed in a little bit more to be able to fully develop that. But I think continued cooperation with the CAPE team and this group would be fully supportive to be able to make sure that we work all of these considerations out. Here's kind of a crosswalk between our strategic plan goals and then how our recommendation is addressing this or these goals. And then the exit interview still quite in draft stage. As you can see, we still have comments here from Casito's research and evaluation team, and then feedback from the work group team, because ultimately we wanted to make sure that this still had the ability to make some modifications based off of the best needs that the CAPE team believes would be most beneficial. So here's kind of the questions that we have developed so far, especially with input from that Casito team. But basic demographic section, obviously this is our easy data that can start to look at that point in time data as well as that longitudinal data. But then we also go into some of those questions like bigger general reasons. What's your primary reason for leaving? They have some options, any information, and then we start to look at some like Likert type scales of looking at job satisfaction. What did they like about their jobs? Maybe what was challenging or frustrating. And I will share, if I can share in the chat box, I forgot to say this, I will share links to these documents because I know that I'm kind of scrolly right now. But I'm happy to share links as well if you needed some more individualized or more focused time to look at this. But we dive further into compensation and benefits. I think what's really important is that we all know, we all know compensation is a challenge, right? Across the field, we know compensation, but I appreciate within this that we're looking more specifically instead of not necessarily just we need more pay, but more of what can help to offset. Okay, if we ultimately can't pay more, what would be beneficial to offset? Is that health insurance? Is that life insurance? Is that different benefits? Is that, workplace satisfaction, culture, whatever that may look like? So we kind of dive a little bit deeper into just we need to pay them more or we need more pay. We also look at opportunities for professional development and growth, and I really appreciate the tie-in with the career pathways on this one. So looking at career advancement opportunities, if they felt like they had adequate professional development, what was useful, what was not useful. So bringing it beyond just checking a box that they got their hours for the year, but more so looking at how we can help to support effective professional development opportunities throughout the state. Addressing work-life balance and mental health, always key, right? Especially in this field, is looking at opportunities for support as far as organizational culture and management, maybe from a leadership position if they're in a center-based, opportunities for family childcare providers to address mental health concerns as well, and maybe if they had support or what kind of support they would have liked to help identify some of those systemic supports that we can put in place. And then kind of just a catch-all at the end, just looking at overall, what's going right, what's going well, and then what could be done differently to help improve that experience and then retain you in your current position of the field or in this field altogether. So, yep, thank you, Lindsay. And if we can go back to the PowerPoint. So kind of our next steps as we move forward, we'll take the time if there's feedback here today or within, as you all have time to look at these wordy documents. If there's feedback that we receive that is pertinent or that we want to make sure to address, we'll make sure to address that, making sure that everything is aligned and responsive to the feedback from this group. And then we will work with the CAPE team that's taking over the project to ensure a smooth and collaborative transition. So that includes sharing the materials we have, answering questions, being available as needed, And then even after the handoff, they asked specifically, and we wholeheartedly agreed that we'll stay available to provide continued support, whether that means helping to troubleshoot implementation or offering context behind maybe some decisions that may have been made or something in these documents that they need some background or context behind. We're happy to stay available with them and then serving as thought partners along the way for this implementation process. And then as updates are available, we look for opportunities to connect back with this group and to keep informed for this whole group. So that's all I have. If there's any comments or suggestions.
It's Amy.
Now, this is Amy Gottchammer with Googles of Learning. Stephanie, you're going to see when I do our presentation how much we overlap, and we really should be doing more work together. So with recruitment and retention, there's as much of what your work does that impacts what we do. But it's a small thing, but one thing that popped out at me when you were talking about, you used the phrase, I wrote this down and put it in quotes, work-life balance and mental health. And I thought that really struck me because we also in our work have been using the phrase mental health supports as something that providers need, right? But you're right, the work-life balance thing is different than that, right? I mean, it sends a different sort of a message to say, hey, maybe I just need time off to meet my kids on early release Wednesdays from school, or I've got a parent that needs, I need to go with them to doctor appointments or something else that's kind of not like I need telehealth for mental health, meetings or whatever. It doesn't send the same kind of a message. It means work-life balance is a different message. And I appreciated that you guys kind of put those together and said that I have these added stressors that I need to account for when I am a full-time employee. It doesn't mean that I need, counseling or whatever. It sends a different kind of a message, but I do have these stressors in my life that I need you to help me account for when I am your employee. So I just wanted to say kudos for that. That really struck me. Thank you.
Yeah, Amy, I appreciate that. I think it's important to be really intentional about seeing the difference and knowing this field and knowing that's not the same thing, right? And that work-life balance can be a challenge, especially family childcare providers. I mean, you as a center director, I get that, former director, like work-life balance is a struggle for many positions in this field for sure. Yeah, thank you.
Any other comments or questions? If none, thank you, Stephanie, for the update. Lindsay did say that she would be happy to share the links, post-meeting and, email those to everyone. And so that way we can make sure that everybody gets it and can kind of take a deep dive as you suggested, just in case people want to look further into questions or anything like that. So, so thank you again, Stephanie. Next, may I have a spokesperson for the mental health work group, please?
Good morning. I'm Hillary Kane with Kansas Parents as Teachers Association, and I'll be providing an update with the mental health work group. So just here on this first slide, I have what the purpose and focus initially was for the content of this work group. And that was obviously, as we've heard in some of these other work groups, that given the high stress and emotional demands of the early childhood profession, we know that mental health supports are really crucial. And so we started looking at several things in order to determine what was needed. And I'm just going to share some of those pieces. If you could go to the next slide, please. So we initially started with having Stephanie Parks from Casito share with the group the findings from the statewide workforce study. And we looked really closely at reviewing those policy briefs from the study, including one specifically on well-being. The group then discussed the findings in depth to determine the next steps for moving forward. And this really took a couple of different sessions in order to be able to have good discussion and really analyze that data a little bit deeper. Following that, our group started looking at the 8 dimensions of wellness. And thinking about that, we were looking at all of these dimensions as important components for wellness for early childhood professionals in the state of Kansas, including the physical wellness, intellectual, emotional, social, spiritual, occupational, financial, and environmental. Next slide, please. Following those discussions, we did decide that we were going to invite another partner to the discussion. And at that time, Jessica Mustafa, who works with Wild Hope and has been a partner for CAME and CAPATA in the past, did join our group to be able to help us think through some pieces as a professional in the mental health field, and provided quite a bit of insight around the discussions that we were already having and the work board that we had in place. The group then identified 3 key systems where targeted efforts could have a more significant impact that we felt: affordable and accessible substitute services, a reflective supervision model with training and implementation support that would be statewide for early childhood professionals, as well as access to quality mental health therapy services and support for early childhood professionals. Obviously, those are lofty goals. We all know that sitting here. We heard some of those pieces in the previous update, and thinking through what those things need to look like requires not only a lot of supports and someone to house those things, but also the financial components. The group then created a shared board on Canva where they could place their current ideas, suggestions, and needs for ongoing discussion and planning. And following that, Lindsay did connect Megan Cluth and myself. And so Megan and I met and had a discussion that was centered around potential areas for partnering. And so this discussion included the current efforts that are happening with PDG and the All In for Kansas Kids strategic plan around the mental health supports for professionals. And next slide, please. Then Megan joined our May work group conversation. And during that time, we did go ahead and update and share with her our current ideas regarding a landing space location that would be virtual for professionals to easily access resources, get connected with other professionals who were implementing successful research-based tools and models, and learn about professional development opportunities and partnerships that were happening in the state of Kansas right now. And we had a lot of discussion at that point in time about agencies partnering with a shared voice to support and normalize that everyone has mental health, and creating that shared message for organizations. That seems like just a simple component, but we really do not have a shared message for organizations right now that is in place to be thinking about the mental health component and the need for that. Next slide, please. So where we have landed at the end of this year with our work group is that these are our vision and goals and recommendations that we have. For the immediate and short term, we would like to see a mental health supports landing page within the existing structure. So we started having quite a bit of conversation about where that could be housed, what that would look like, and that we want to make sure that it's easily accessible. So a space that everyone already knows how to navigate and get to. We also talked about agencies partnering with that shared voice, as I shared before, to support and normalize that everyone has mental health, and that we could do work around creating a shared message for organizations. Another piece that was discussed is the possibility of a mental health convening in the fall. So having partners from different agencies coming together to really have some thorough discussion about what this could look like, what are the needs. While we did go through a lot of that survey data that happened with that workforce study, we also realized when we were reviewing that data where there were gaps in individuals who were able to contribute and share their voice. And so there's a real need for that. Another piece that we are recommending is that we would have mental health moments and mental health matters video series that would hopefully also be housed in this landing page. And that would help to normalize conversations on mental health, address building adult parent resiliency and supporting children's mental health, and also focus on explaining mental health services in Kansas for children and adults, and encourage the early childhood education workplace mental health supports. Long-term goals that we would like to see happen is an educator toolkit for managing in the moment stress. So something that would be available across the board that everyone would have access to. And then also a general mental health policy and procedures, supports and recommendations guidance available as a resource for partnering agencies. Next slide, please. I think that actually might be it now that I say that. Yes, because I think we took out the last part. So that is my brief update for what we've been talking about and where we're at with our mental health group. Obviously, we're at a place where we have a lot of great ideas and things that we would like to see happen here, but they're going to require, the support of other agencies and as I said, the pieces that are already in place. And I know that Megan has shared that there could be some great support from KUCPPR and some of those things that could be happening. So that is what I have for update. I'm happy to answer any questions. I think I'm the only person that was able to attend this morning from our group. So
Thank you, Hillary, for the update. Do we have any comments or questions? Okay, if none, thank you again. And may I now have, can we have a spokesperson for the Targeted Journey Recruitment Work Group? Ms. Amy.
Sorry if I could come off mute. Yes, this is Amy Gottchammer with Googles of Learning, and I am your spokesperson for Targeted Journey Recruitment. And here is our group. I apologize, I didn't get a fancy enough slide with everybody's place of business and whatnot, but here's our most amazing team. And they've all been just great support. I'm thankful to each and every one of them for all of their input this past year. So thank you to all of them. And our next slide. So we have been down a long and windy road this past year. One of the first things that we found was that we kept going down all of these different rabbit holes. You know, how can we bring more people into the field? And you come to the usual conclusions, right? We need more money, we need more benefits, we need more mental health supports, we need more family-friendly policies. All of these things were already being done by someone, right? So we kept saying, like last year, I was on the recruitment and retention group for the recommendations panel last year. There was another group that was doing wages and benefits. This year we have a group that was doing mental health supports. We have a group that's doing family-friendly policies. So we kept coming sort of to a dead end saying, this isn't our lane. What are we doing? Somebody else is doing this work. So what are we doing? And so we had to keep readjusting and reinventing ourselves. And so what we ended up doing was coming back to the work that we did last year, which was we set up the page on the All In for Kansas Kids website, which was focused on recruitment and retention. And we started reevaluating that and looking for where we needed to make corrections, where we needed to add new information. And then in addition, the second big piece of what we did, and I'll get into the details of both of these, was that we did go into one specific area where we discovered that there were some misalignments between how we recruit high school students and in their preparation for their future as preschool or childcare teachers, and that the way they are prepared in the KSDE and the CTE programs and how they come out ready to meet requirements for a KDHE in like a community-based program. So that was something that we do have some recommendations for. But first, let's talk about where we went with the website. So if I could have the next slide. So how does this all relate to the strategic plan? And we're definitely in pillar 2, goal 2, and we thought that the action particularly most closely aligned with the identifying and implementing effective models for recruiting professionals and programs that across the full continuum of early childhood services in the ecosystem. And the reason that we're kind of looking at that was that when we started drilling down into the pathway for these high school students that are in early childhood programs, we're finding that they're well trained to move on to higher ed, but that they're lacking some pieces for the kiddos that don't go on to higher ed, but go directly into the workforce. They're missing some of the requirements that KDHE would require for a professional in the field. So there's a little bit of a disconnect there if they go straight into the field. So to make sure that they are actually prepared for the full ecosystem, there's some things that we need to rectify there. Next slide. And then in terms of the progress tracking, which we see on the strategic plan, and I loved what Chavis was talking about in terms of accountability and where we go. So I did pick this piece up from the progress tracking on the strategic plan that we could gather this data regarding why people leave, and that would be gathered on CAPE. So again, now we're talking. There's so much overlap. I was just been so excited watching and listening to everybody so far this morning. So the things that Stephanie was talking about in the exit interview looking for these patterns and ways to improve. So again, we need to get together with Stephanie and be talking about why people are leaving. And we know it's the money, we know it's the benefits, but beyond that, if we can't solve those great big giant problems, what can we do? And so those are some of the things that are on this Stalling for Kansas Kids website already, the things that we already did last year, all of the changes that we're making this year. There's already information up there that people can be looking to right now. So that was a lot of what we did last year and this year. Next slide. So again, this is the work we did last year. We created with the help of Rachel Sisson and the KUCPPR, we created that webpage on All for Kansas Kids, devoted to recruitment and retention. And we created it with 4 audiences in mind. So your boots on the ground professionals, your teachers, your directors, your state agencies and organizations, your advocacy groups, and your local coalitions and communities. So, you've got a local group, you've got a local chamber of commerce, somebody like that wants to help bring new business to the area, and they're looking for ways to really support childcare for these potential new employers. They're thinking, what can I do to help? They can go to this website and they can look. Or a director of a program somewhere in Western Kansas or anywhere, whatever, can go look at this and say, what can I do to help support my employees, my professionals? They can go on this website and they can look for ideas for ways that they can help support. These are all ideas other than wages and benefits. These are all the other things that you can look at. So again, last year's work looked at what are the things that, and then this will probably, these are themes I'm sure you will see when you're doing the exit interviews. These were the things that we came up last year with that are reasons for people leaving the field. Other than wages and compensation, it was, we don't feel respect. We don't feel that people respect the work we do, that people don't value the work we do, right? So the positive of that was, how do we change public perception? That we need to change public perception. So that was one of the first categories. So we have ideas for changing public perception for each of these 4 audiences. So if you click on that tab, changing public perception, there's ideas for each of the 4 audiences. One of the other things that we pulled together was the feeling was that there wasn't anywhere to go. They felt stuck. They didn't feel like they were growing in any way. They weren't moving along any sort of a career pathway, right? So they got there, they were an assistant, they were a lead, and then they just were stuck. So investing in growth, and what does that look like? Yes, it's a lot of professional development. Maybe they're getting a degree, maybe they're getting a certificate, maybe a credential of some sort. Maybe it's just a program that says, hey, I'm going to have these specializations that I create within my own program that says, if you go and you agree to get 4 or 5 classes under your belt in family-friendly policies, I will make you my family engagement specialist. And that gives them some pride in who they are and what they can offer to that program, right? It's not anything that anybody else recognizes except within your own program, but you could offer them a little more money, and you can put a tag under their name on your website, or under their name in front of their classroom on the door, or whatever, says you are our family engagement specialist, right? These are just ideas that are on this tab, Invest in Growth, that will help people take more pride in their work and feel like they're growing as a professional. And so all 4 audiences are addressed, and Invest in Growth is the category. Prioritizing mental health, again, is another category, and there are suggestions for all 4 audiences. And then strengthening small businesses, recognizing that for family childcare providers, this is a small business, just as it is for a small center. It is a small business, and that people got into it thinking, maybe I'm going to watch my kids for a little bit until they get older, and then they stay in it, and they're realizing this is more actually a business. I need to know how to deal with my homeowners association, or I need to know how to deal with the zoning requirements, and I have to have liability insurance, and all of these different things that maybe they hadn't thought about before. And they just don't know where to go. So what can we do to help give them the information they need so that we can strengthen the small businesses? Because we know half of Kansas kids are being cared for in family childcare. So strengthening small business will make sure that we have more providers out there and we can help support them. So again, if those same audiences are addressed, they all have a variety of different ideas in that category. All of this was done last year. Now we can go, you can see the website down there. So this year's work was built upon last year's. We spent a couple of months reviewing all 4 areas. We fixed broken links. We added new content. We reached out to the mental health group. And now I'm realizing I really need to get together with Stephanie and the exit interview group, see what else we need to add and build upon in here as well. We've got a large list of things that we're going to be providing back to KUCPPR to add, so some of the things are, for example, we had information about the career pathway, but we didn't specifically have any note about, say, the career navigators. One of the things that is on the website are these spotlights where they want more dynamic information, because otherwise the website's pretty static. So this is just to say, we've got a conference coming up or something else. We thought maybe we could spotlight the lunch and learns with the career navigators, for example. So things like that can be added. We took off the Kansas Association for the Education of Young Children, unfortunately, because now that organization doesn't exist, but did last year. We have added some different training opportunities. Yes, we want everybody going to CAPE, but at this point, not everybody is on CAPE, and there is still good training information out there. You can still go to Kansas Children's Service League. That wasn't on our list. Child Care Education Institute wasn't on our list. The Kansas Department of Education has some great CACFP courses that aren't there. CAME wasn't on our list last year. So we have improved that, added those links. We had information about using substitute pools, but we hadn't specifically listed Customized Early Education, who is the group that does the substitute pools. So we now have a link to their website on there. So all of these things have just been improved upon and added to. So, and as we continue to work with each of you now, I think we're going to have even more information to add to that website to make it a little more update. And then we are going to put out that information again about the spotlights. If you guys have information, they want that spotlight information so that does stay dynamic and current. So anytime you've got something that you think is worthwhile to any of these, whether it's investing in growth, the perfect place for the conferences and that type of thing, prioritizing mental health. Again, it could be a conference, it could be a CAME conference or something else. That could still be a great place to put a spotlight. Anything like that would be wonderful. So I think that's probably it for that slide. So again, why say investing in growth, incentivizing early childhood professionals to learn new skills and advance in their careers. We can help attract more professionals and reduce turnover rates. So, this is why we're doing it. Investing in professional growth fosters that sense of value and support, which leads to higher engagement and stronger retention. So, all of this speaks back to, the retention piece that we're trying to do, as well as the recruitment. So, okay, next slide. Okay, so the next piece of what we got into, it came to our attention, primarily me, because I had been, I usually work with our school district. I take interns from the high school to work at my center, and I was being presented with certificates for training that they were doing in class, and finding that the certificates in particular didn't look like certificates I was normally presented with. I normally get certificates from providers or from teachers that have KDHE approval, that look like something that tells me how many hours they had, tells me, look, this was obviously a class in health and safety or something else. It's got a core competency on it. It tells me what the CDA subject area was. This kind of a certificate didn't have that. It had the content. It would say that they learned about safe sleep, or they learned about transportation, or they learned about infectious diseases, but it was just sort of listed. And I'll show you this in a second. But it was just something that wasn't, as I said here, universally understood within the community. And so that was kind of something that I thought was a disconnect for me. I thought, I don't really know what to do with this. Showed it to a licensing surveyor. They hadn't seen anything like that before. And so I started thinking, this is something, I wonder if this is happening in other programs across the state. So that prompted conversations with KDHE and Jarvis Stolman and conversations with Natalie McLean and KSDE. It prompted a conversation with Taylor Spangler with CTE and KSDE. So what it seems like is that the content for the basic foundational classes that they're getting is not in question. They are getting the same kinds of foundations module information that anybody that takes the course from Casito would get. But it's just not universally spelled out on the certificate. So when a director like myself receives that certificate, it doesn't give me that same information. So I don't know really what to do with it. So what we're looking at is how do we document the education in a way that's universally understood across the community. So one of the other things we also noticed was that at least in this school district, and again, I don't know if this is the case in other school districts, but that they were coming with pediatric CPR, but not pediatric first aid. That does not meet KDHE requirements. So that required me having to pay to send them through another training, which you cannot just take pediatric first aid. You have to take it as a combined class. So I had to pay for them to take pediatric CPR over again with a first aid class. So they had to take it twice and I had to pay for it in the second case. So they now have what they need, but that wasn't sort of what the idea was. They were supposed to be leaving high school completely ready to go out into the workforce. And that isn't really in effect what's happening. So if we want to make sure that they are leaving workforce ready from high school out of these ECE programs, we need to take a closer look at what are the KDHE requirements and are they meeting that? And so that's going to take some more discussion between what KSDE is having the high schools do in these programs and what KDHE is requiring. Okay, next slide. So just as an example, here's what a Casito foundations class, the basic health and safety class that everybody has to take. It tells you what's in the class. It has a KDHE approval, tells you it's an 18 clock hour class that covers the core competency areas 1 and 5, that 16 of the hours is in the health and safety area, CDA area, subject area 1, and that 2 hours is in subject area 8, which is basic child development. So I've got all of that information on there. And that not only tells me that, that it's KDHE approved and how many hours I should credit them for, because they have to have a certain number of professional development hours each year. It also tells me if I were to be mentoring this student to, say, get their CDA, they have to have a certain number of hours in each subject area as they work forward in accomplishing their CDA credential. So it tells me that they already have 2 hours in subject area 8 and 16 hours in subject area 1. Go ahead and move to slide 2 or the next slide. This certificate that I got has none of that information on it. It tells you all of the areas of the content that they covered, but there's no documentation that tells me how many hours any particular thing was. There's no KDHE approval. There's no core competencies listed. And so as a director, I cannot mentor this student. I can't help them accomplish the CDA. I don't even know, how many hours to say. No, it does say 1.5 CEUs, but in speaking with the student that took the class, they said it was a 2 hour a day class that met 4 times a week over 16 weeks. It was 128 hours or something for one semester. That is well over the 18 hours that somebody would get if they took the foundations class in health and safety from Casito. So it doesn't align. Do I account, for 128 hours or whatever that number adds up to, for the year? I mean, yes, they're done. 1.5 CEUs. I assume that is supposed to be, that's a high school number, right? That goes on their transcript. That means that they have 1.5 credits for high school, and that class goes on their transcript, but it just doesn't easily translate into what we do in the workforce. So that's where we've got this disconnect for how are we helping these students easily move into the workforce along the career pathway. We need to make it so they have have a document that works easily so that they can easily move into the workforce. Okay, so that's next slide. So again, that specific issue is that there's no KDHE approval, there's no core competencies or CDA subject hours listed, there's no breakout of how many hours were spent on health and safety topics or child development or anything else. And again, you have to have a certain number of health and safety hours each year. And so I can't tell from that certificate how many hours they took in health and safety. Probably in that particular class, they're well over the requirement. I just don't know exactly what that number is, and I can't help them working towards a CDA with that kind of a certificate. I don't even know if a certificate like that would be something that a CDA specialist would be able to work with. And again, that's a different issue altogether. Next slide. And this, okay, so this is yet another little bit of a rabbit hole we went down in terms of workforce and people that we can recruit. We frequently get elementary paraprofessionals that reach out to licensed childcare centers because they want summer work. They can't work the full 12 months of the year. So they come to us and they want to work with us. They've worked with young children throughout the year. It seems like a natural transition. So they come to us wanting to work in the summer. But I have to tell them, well, the first thing you're going to have to do is take this 18-hour class. And I have to do a background check and fingerprinting before you can even start. Well, they have to they have to do all of these things. And so the problem is that, there's no, you can go to the next slide. There's no communication because they've already been fingerprinted for KSDE to work in the public schools, but there's no communication in that way. And this is a bigger problem than the state. I know this is a federal issue and this is something that people have been trying to work with, but it is problematic because we have to then pay for background checks. We have to pay for them to go get fingerprinted and have it be in the KDHE system now. Having them take foundations is again, another cost and a time consideration. So what we are thinking about is our recommendation would be, is there a way to create a committee with both KDHE and KSDE at the table, as well as community providers like myself, other directors, and higher ed representatives. And this committee then, maybe under the auspices of the new Kansas Office of Early Childhood, but that could work more closely to align the CTE programs with training and training for paraprofessionals with the child care licensing credits, right? To make sure that they're all under KDHE requirements so that they're getting the training that they need and the pediatric first aid and CPR, so that they're meeting all of those requirements, so that not only the high school students, but also paraprofessionals who, think that they might be wanting to work in the summers could be prepared for that going forward. Next slide. The more we can reduce the barriers, the better the workforce will be, right? So in addition to meeting those KDHE requirements, we'd also like to see, and this is just a higher level thing, but we'd like to see that ECE high school students across the state are also receiving training in the new core comps, the Kansas Early Learning Standards, be introduced to the career pathway, get enrolled in CAPE, and leave their programs having completed an IPDP. These are just extra standards that we'd like to sort of see be in place. And again, with this committee, if they could sort of set that goal or that expectation across the state with all of our school districts, with all of those ECE programs in the state, if that could be set through KSDE as the expectation, then they'd be career ready. Whether or not they go on to higher ed or they go right out into the workforce, they will already be, in the CAPE registry, already be familiar with all of these new and exciting tools that we've prepared. We'd like to suggest that paraprofessionals could take the same foundations module that other providers take, and maybe in some way get dual professional development credit that could be recognized by both KSDE and KDHE. So that we know they have to take professional development for KSDE, but if it could do dual duty for them, then they could maybe take it in the year prior to the summer that they might want to work in early childhood. They could get their credit for it at KSDE, and it would also be KDHE approved. Then they don't have to come to us in May and say they would like a job and have to start a 10-week class. They could already be done in advance. They'd get their credit for both, and then they would be ready to, short of having to figure out the fingerprinting and background check issue, they could be ready to go as soon as school gets out in May. Again, just looking to reduce as many of the barriers as possible to get the high school students and the paraprofessionals ready, kind of hit the ground running as soon as they get out of school. I think I'm ready for the next slide. So again, the benefits to workforce recruitment is just that we're identifying and implementing effective models for recruiting professionals. So reducing the barriers for the high school students that are not going directly into higher ed programs, but rather into the community-based programs by having the appropriate training and meeting these minimum KDHE requirements. Investing in their growth by ensuring that they're trained in all of the core comps, the KELS, career pathway, CAPE, and have IPDPs on all the tools and resources necessary to feel supported when they enter the field. The next slide. And again, attracting paraprofessionals by having coursework available that gives dual professional development credit and that just help support another pool of employees for community-based programs during long holiday breaks, and to support the paras that are looking for work, and to reduce those barriers for paras by recognizing, we do recognize that fingerprinting and background checks are expensive and problematic, but we would encourage the work group to continue looking for ways that these security steps, once taken, could be recognized and shared across both KSDE and KDH to reduce that duplication of efforts, money, and time. Okay, I think that might be it. Next slide. That's it. So that's me, that's my email, and that's my phone number. Any questions?
Questions or comments for Amy and or the work group? Okay, Amy, I definitely see the overlap you mentioned, right? When we look at, the work, and so definitely see that, which I think honestly emphasizes maybe some of the problems, challenges, the needs, because when we see the same things being discussed in multiple groups, that brings it to light that there really is something that needs to be addressed, and or so I definitely see that overlap. Well, thank you again for your presentation. May I have a spokesperson now from the System Progress Communications Work Group?
Hi, this is Heather Schrottberger from the Kansas Head Start Association, and I'm going to give the update for this work group this morning. So this first slide is just, again, what the focus for our work group was, which was basically to look at communication and system level communication, and what strategies might be to be able to share information amongst all the parts of the early childhood system. Next slide is a list of our work group members for this year. So a few of them are on, and appreciate everyone's work together as part of this work group this year. Next slide. So we spent some time considering what different directions might be to go with this goal, and really wanted to hone in on something that we could make some progress on in the short amount of time that we had together, and be able to hand something off at the end of June. And so initially, we decided we just needed to understand a little bit better about how communication flows or was currently flowing between various partners, groups, organizations within the early childhood system. So we conducted an inventory of the organizations and work groups that are identified in the chart of the Kansas Early Childhood Governance Structure, plus other work groups and organizations that we knew were kind of closely associated or right on the periphery of that structure. And so primarily we were working to identify what's the purpose of this group, who are the key contacts, how does information flow to that group or out of that group, what do they meet, how do individuals become connected with them. And then we also wanted to draft some strategies for enhancing updates and information sharing about work between those entities. Next slide. So after we did that, we decided that we needed a little bit more concrete information to round out that inventory. So we had some gaps in information after doing some individual outreach. So in progress right now, and some of you may have received this from Kelly, who is on the work group. But we put together a survey for each of those groups and organizations to verify the information that we had about their group, and communication processes and opportunities that they offer. So thank you to everyone who has sent that survey back thus far. And we look forward to receiving responses from others who haven't had a chance to do so yet. The other activity that we currently have in process is we've started a draft of what we are tentatively calling a system communication guide. And this draft includes two things. One is recommendations for cross-sharing of information across the organizations and groups and work groups, et cetera, in the early childhood system. And then a cheat sheet for who to contact and how to interact with each of those. So if you go to the next slide, I think I have an example. Oh, this is the draft of strategies for cross-system communication. So this is not final, but this is what we have thus far. Primarily focuses on suggesting that each group create an inventory of cross participation by their group members and keep it updated regularly. So for instance, for those who are part of your work group, what other work groups or organizations are they part of? To add a couple of standing agenda items to all agendas kind of uniformly, which would be one at the beginning of each meeting so that individuals can provide reports and updates based on their representation in other groups, coalition, and task force, and include those brief reports in the meeting minutes to ensure that everybody has that information, even if they weren't present at the meeting. And then connected to that would be adding a standing agenda item at the end of each meeting to provide time to identify who will report out or share information, needs, action steps, opportunities with other groups or coalitions or task force that they're a part of. We added to that to include a list of key takeaways and meeting minutes, and then provide space to follow up on that. So just creating kind of a feedback and communication loop via meeting agendas. And then continuing to share opportunities for participation or communication with others, and request opportunities to share with other groups, coalitions, or task force when you don't have cross participation on your group. Next slide. We also included in that draft guide the start of some recommendations for panel members, thinking about how the panel serves as really this kind of nice place where individuals who represent all of these other pieces of the early childhood system come together. And you might read these and think, oh, those seem very common sense, but it's just kind of a formalizing that everybody would think about doing these things. So prior to each panel meeting, be sure that you identify the updates or bright spots or opportunities that you want to share when there's opportunities to do so on the panel agenda. And that if you're a panel member and are a regular attendee of other meetings, that you utilize opportunities you have to share out what the panel is working on or what you're learning. And then also, as we're always invited to do, share ideas for panel agenda topics and discussions that create opportunities for cross communication. Next slide. Then the second part of that draft system communication guide is that outline of groups, those within the governance structure, those loosely connected to the Kansas early childhood governance structure, and then statewide early childhood partners and organizations. And so we are in the midst of populating those tables, but you can see what the headers are. So who is the group? What is their mission? Who's the contact? How do they connect with the EC system? Who's their key audience or population? And then what opportunities do they offer for sharing communication across the early childhood system? Next slide. So where we are as we wrap up our work in June, our recommendations would be that this work group continue into the next year to finalize that guide, figure out how to publish it in the appropriate landing spot, and then create a process for keeping it updated and shared. And then that the work group finalize and possibly move ahead to recommendations about additions to panel meeting agendas. One would be if there was a possibility of having a summary of key takeaways after each panel meeting that individuals can share out with others. And then the other would be adding to the beginning of the panel meeting agendas a standing item where individuals could share any feedback or responses they heard when they shared out those key takeaways within other groups or settings. I think that was my last slide. So that's where we are kind of in progress as we finish up our work in June, and what we would recommend that this work group take on if it continues into the next panel year. So happy to answer any questions, or any other work group members, I'm sure would be happy to answer any questions as well.
Any other comments or questions for Heather and or the work group? Okay, if none, Heather, thank you for the update. So great to hear all of the work that has been done. You can see that everybody has been busy, right? Yeah, it is so, it's amazing to be able to see progress that's happened. You know, some groups I can see, okay, yeah, we probably are going to continue that for the next group, next year. Some maybe we've already wrapped that up and it's time to think about other initiatives, but, you know, we'll have 25, 26 to kind of think about all of that. So as you all, those of you who are returning, may have read in your emails. This is my last year serving as chair of the Early Childhood Recommendations panel. And I would like to take a moment to introduce and welcome you all to the new chair, but also the Kansas Children's Cabinet and Trust Fund's Early Childhood Systems Specialist, Miss Melissa Schoenberger. And so she will be taking over chairing the committee, you know, the panel going forward. And so Melissa, would you like to hop on and say hello to everyone and just tell everybody a little bit about yourself?
Sure. First, I would like to thank you, Cornelia, for sharing and doing such an amazing job. I recognize that I have big shoes to fill as part of my onboarding with the cabinet has been listening to the panel in past meetings. And what a amazing person that has really sat at the helm of the panel over these last years. And just really want to give a virtual applause because I know everybody has that to you and the work, and want to recognize that you're not leaving us. So you'll be shifting into a new role as a panel member. So speaks to your commitment to this work, and looking forward to partnering with you and the rest of our returning members over the next year. That being said, I'm not unfamiliar with the work, and quite frankly, I am exhausted just taking notes of all of the committee members' work to date, and what a great meeting to join, and really energizes me for the next year. My role with the, particularly with the cabinet, is to work on alignments, coordination, and collaboration by working across sectors within lots of early development initiatives that the panel oversees and that the cabinet really looks at. So just getting my my feet wet in this work, but many of you love to see familiar faces today, have known me in my past tenure as one of the co-directors of the Child Care Licensing Program. Many of you, Jarvis Dolman is on today. For the last 2.5 years, him and I served as co-directors. His was operation side of CCL, and my focus was mostly in field services and our systems work. So this seems like a natural transition. And I also shepherd the systems improvement team for childcare licensing, which is right under and flows right into the work within the panel. So I really feel honored and humbled to be a part of this group moving forward, and can't wait to see the work of the next year. So if anybody knows me very well, buckle up, get settled in, because it's going to be a really adventurous year moving forward, and looking forward again to July 18th when we get on screen with the new panel members and really dig into orientation and setting the tone. Really, again, humbled, can't wait to dig in, and looking forward to the next year. So that being said, Lindsay, I'll throw it back to you and Cornelia as we wind down today's meeting.
Well, Melissa, thank you for your kind words, and I'm looking forward to now just kind of, being here and attending the meetings. I told Lindsay before the meeting that I'm going to have to remember to not pop on and say, like, does anybody have any questions, any comments or whatnot, or, that kind of thing. And so if you see me like get ready to do something, then just like tell me to shoo, whatever, just because it'll be habit.
Never. And please do it anytime. So love that.
Thank you. All right, so time for bright spots. And so does anybody have any bright spots that you would like to share with the group? Know that there's something happening within your organization, within your community, or at the state level. Okay, no bright spots for the day. Okay. All right. So please remember that there is going to be a post-meeting survey that Lindsay is going to send out. That gives an opportunity for everybody for us to look at kind of the feedback of our meetings, to make sure that the meetings are productive and that you're finding value in those meetings, and gives you just an opportunity to provide that feedback. We're going to have our next early childhood recommendations panel meeting, which is the orientation. It'll be kind of the first meeting of the new year on July the 18th at 9 o'clock. The next Children's Cabinet and Trust Fund meeting will be on August 1st. That is going to be live streamed on the Kansas Children's Cabinet YouTube page, and that's from 9 to noon on August the 1st. We will go on ahead and we'll do a 15-minute break just to make it easy. And we'll come back at 11 o'clock. It's 10:45, I guess. I guess we could do 10 minutes, I guess. Do you have a preference, Lindsay? Nope. Okay. All right. So we'll come back in 15 minutes at 11 o'clock. If your work groups are meeting, Lindsay will have the rooms open for you to be able to meet with your work groups. And if not, then I hope that you all have a wonderful weekend. It seems like Mother Nature threw a fit this past couple of weeks, and we've had people still recovering from all kinds of power outages and trees down and all kinds of craziness. And so hopefully you haven't had any of that to deal with, or if you have, you are on the road to recovery and can just enjoy a warm, summer weekend. So you all take care, and look forward to seeing you all in the meeting in July. All righty.
Live stream. Okay.
All right, Ms.